In this video, we will see how Biotandem can assist when a patient with a chronic condition who is on long-term medication is scheduled for surgery. If this patient is already in your Biotandem records, the system recognizes that she is 28 years old, woman with Crohn's disease and asymptomatic under adalimumab and azathioprine treatment. She has been scheduled for cholecystectomy due to gallstone disease. Since gallstone disease is already added to the biotype, simply search and add cholecystectomy from the search bar or from the gallstone disease intervention section. After adding cholecystectomy, you may refine your biotype by selecting laparoscopic cholecystectomy. Don't forget to select perioperative setting for a scheduled surgery or one of its subsettings. Whenever you want, you may switch the subsettings from here. Let's select perioperative now. If you want to select perioperative setting to see the relevant recommendations, even without selecting a specific surgery, just add perioperative setting from here again. In the perioperative setting, key features you see and explore several range of relevant features, such as preoperative assessment category here, or perioperative complications, or explore perioperative tool section to understand how risk factors are determined. For example, you can see how EGFR values correlate with the perioperative risk, as you see. Next, go to the BioBook tab to see the customized information set for this biotype. Selecting perioperative setting from the index displays all necessary perioperative considerations across different organ systems for this biotype. For example, under hemostasis section and coagulation, Biotandem provides guidance on managing bleeding thrombosis risks related to Crohn's disease, related to laparoscopic cholecystectomy, or related to surgical bleeding risk category. At the bottom of each information block, you see the source of the recommendations here. Adding Crohn's disease from the left-hand side, you focused perioperative considerations for Crohn's disease only, or selecting azathioprine from the left side will indicate whether this medication continued during the surgery. Here are the recommendations. The same applies to the adalimumab. Check whether modifications is needed during the perioperative period here, or its risk on the body defense, and see the source of the recommendation. Combining with laparoscopic cholecystectomy, from the left you see some surgical recommendations for laparoscopic cholecystectomy or combining the bleeding risk of surgery. See what should be done for a surgery with this category. Here's the recommendations. After the perioperative period is over, remove perioperative setting from the biotype. However, cholecystectomy will remain as a permanent part of the patient's biotype. This structured approach helps ensure that all critical factors are considered for the safe management of surgery in patients with chronic conditions. Thank you.